Hello and namaskar. Today we are going to talk about the remedy Silicea from Dr. Nash's Materia Medica, and at the end we'll also discuss about the remedy Calcarea Phos. Since Calcarea Phos, Silicea, along with the remedies that we've done like Sulphur and Calcarea carb, come under the group of Anti-Psoric Remedies by Dr. Nash. Anti-Psoric Constitutional Remedies by Dr. Nash. We'll first start with Silicea, and then we'll go to Calcarea Phos at the end. Okay. So the topics under which Silicea has been discussed is first of all the constitution of Silicea and how is the Silicea child, in which actually many important aspects of the remedy have been covered, and the action of Silicea in suppurative pathologies, meaning where pus is formed, okay, where there are discharges, where there is a septic kind of situation, and the weakness in Silicea, modalities of Silicea. Okay, so let's start with the constitution, the first part. So, when talking about the constitution of this remedy, Dr. Nash tells us that the silica subject is, very weakly, with fine skin, pale face, lax muscles. So, muscles are, like kind of relaxed. He is nervous, irritable, okay, weak. Like Calcarea cup wasn't nervous or irritable, but wasn't nervous actually. Calcarea cup was very sluggish, but over here, Silica is nervous, irritable, weak, faint-hearted. So they lack in courage, yielding, like giving into the authority of anybody, yielding, very easy to convince, and has a giving up disposition. This is how Dr. Nash very briefly talks about the constitution of this remedy. Moving on to the description of Dr. Nash on the silica child, he says that these children have a big belly, and that big belly is because there is diseased mesentery, so there is some problem in the large intestines. Okay, the limbs and the eyes are shrunken, there is pinched and old looking kind of face, does not increase in size or strength. So this baby will not increase in size or strength, will learn to walk late, growth and development is also late, it actually comes to a standstill. So this is a kind of actually an emaciated kind of a baby with this because he is emaciated, not having the proper nutrition due to malassimilation, there is this kind of whole situation where there is pinched and old looking face, pale face, right, big belly, and there's no growth, and all the milestones are delayed, right? Then Dr. Nash moves ahead to talk about the constipation and diarrhea that these babies tend to have. Let's see what it tells us about that. So here Dr. Nash says that this little fellow, strains and strains due to the constipation. The stools will partly protrude and then will slip back. So these kind of stools which partly protrude and after protruding again slip back, even if the patient is straining and straining, the stools are not coming out. These kind of stools are called as shy stools, okay? So shy stools. And these stools are also found in sanicula and thuja. They're also found in sanicula and thuja. Okay, so these stools, so remember that these stools will partly protrude, then slip back, protrude, then slip back, but will not come out even if the patient strains a lot. So these shy stools are found in silica, sanicula, thuja. Coming to the diarrhea, diarrhea is seen during dentition when there is hot summer weather. Okay, these are the ailments from of diarrhea, and these are very common ailments from in all the remedies mostly which have very peculiar kind of diarrheas. They have the aggravation in this period only. The stools in this remedy are changeable. So you also know that pulsatilla has a changeability kind of characteristic symptom, which is changeability, right? So if the stools are changeable, you might think of giving pulsatilla, right? Because the stools are changing all the time. Now they are yellow in color, then they are green, now they are slimy, then they are watery. You do not know. So they're changing. So you think of pulsatilla, but pulsatilla is also not helping this person. And there are loose stools of every color and kind in this person. Then you can think of silica if obviously the symptoms agree, if the whole picture is of silica. Now this child takes enough nourishment, okay? It is not like they're not eating, they're not getting something to eat, or they are not they are like emaciated because they're not having a good diet, okay? This child takes enough nourishment, but this nourishment, even if it is vomited or it is retained, so even if this nourishment which they are taking is not vomited, is not going out through the diarrhea, is retained, even then the child goes on emaciating and growing weaker and weaker. Okay, so even if the food, whatever nutrients they're taking, are retained, but still what is happening is they are growing weaker and weaker until this child dies of inanition, unless silica treats the condition, obviously. So unless silica comes to the rescue, the silica child will keep on emaciating, getting weaker and weaker, and may even die out of this situation. Okay, so what is happening here is mal-assimilation. In silica, whatever has been taken is not able to, assimilate, and the body is not able to assimilate, and therefore there is emaciation. Now, this silica child also has constipation. Just now we talked about constipation, so let's see this silica child also has constipation which aggravates before and during menstruation. This is not related to the child, but that is what Dr. Nash tells us while speaking of the constipation related to children. So silica also has constipation which gets aggravated before and during menstruation. Okay, so this kind of shy stools they have, and diarrhea mein there's changeable stools and emaciation whole condition he told us. Next, moving on to the next point, which is action in suppurative pathologies in pus forming pathologies. Let's see. Here, when talking about the action in suppurative pathologies, Dr. Nash tells us very beautifully about this remedy, how this remedy can help, and in which stage this remedy can help. So, this remedy, first of all, can help in glandular and bony ulcerations as well. So, as deep as a bony ulcer can also be helped with silica. There has to be suppurative pathology, meaning pus formation, discharge. Okay, pus should take place. So here he tells us about two stages. So in earlier stage, when you have to expedite the discharge of pus already formed. So basically, suppose you have an abscess, so you have an ulcer that your patient has presented to you with, and whatever is the condition, the pus has already formed. Think of it like an abscess. Okay, so there's an abscess, so it was first developing but not yet developed kind of a stage में वो ulcer वो abscess था, and after that it has now just grown very large with pus, a lot of pus inside of it. Okay, now at this stage what you need to do is obviously to discharge the pus. Okay, earlier when there was only a little bit of inflammation, little bit of, maybe the pus formations pathology had just begun. At that point, you might think of giving a remedy which would, arrest the pus formation, which would, heal the inflammation, and this condition at this stage only would be cured. But now at this stage, when the abscess has, completely developed and there's a lot of pus inside, the only solution to this is to expedite the pus, right? To get the pus out of it, first of all. The remedies that will help you in this stage will be Sulphur and Calcarea Sulphur. So these are two remedies which can help us at this stage when we need to expedite the discharge already formed. Now, in the later stages, when you actually have this abscess drained out, okay, so this abscess has completely drained out and all the pus has come out of it. Now this is just like that, okay, with no pus inside. Now what you need is healing. So you need that this place must now be completely healed, and there should not be any more pus left inside or any more pus developing inside it. Completely get better. So now to heal after the discharge has taken place, silica will come to the rescue. So this is the stage where you can help the patient with silica. It may be bony ulceration, glandular ulceration, or abscess, or anything like suppurative pathology, and these kind of stages will be there, and the remedies for these stages are as such as we've already talked about. Then we go on to talk about the next point, which is weakness. So Dr. Nash says that this remedy has a general picture of weakness. Okay, general picture. So he mentions that this remedy is weak as a constitution also. Just now we've seen that they are weak, they have lax kind of muscles, and in the mind also. In the mind also we saw that these patients actually, have this faint heart, meaning lack of courage is there. They are yielding. They have a giving up disposition. So they will, give up to whatever they like. They will not have that, dedication, or they will give up very easily. They are yielding, meaning they will give in to the authority of others. They will be very, very easy to convince. So that is why Dr. Nash very beautifully says that in these patients, grit is all gone. Grit is all gone. Now here, it's very interesting that grit over here actually it means lack of courage. Okay, grit all gone means you do not have that courage, you do not have that thing that you need to stand, to say your point, to go against the opinions of others or whatever. Okay, so you are giving up, you are yielding, you're faint hearted. That is why he's saying that these patients have this thing like grit all gone. But very interestingly, grit in actual meaning, in a literal meaning, is sand, and silica is a remedy prepared from sand. So, isn't it very interesting? And that is why I believe that Dr. Nash uses this word over here. These patients may, the grit is all gone, and also pulsatilla has this kind of situation because pulsatilla is also yielding. Yeah, it is also like it also has this giving up kind of a disposition. Right. Next, moving on to what happens when you give silica to such a patient who is weak, or who is a silica patient and weak. What happens? So, under the action of silica, such a patient may, the spirits arise, the spirits will rise, the hope will revive, and the weakness and the depression that they earlier had will give way to a feeling of returning strength and health. So, silica will bring them back to the grit, their own source, like the sand, like their own source, that is grit. They will get it back. Okay, this condition of weakness seems to attack the general nervous system. Okay, so nervous system is getting attacked because of this kind of a weakness, where you can have, these patients can have cerebrospinal headache. This kind of headaches will begin from the nape of the neck and will run forward over the head to the eyes. Okay, so suppose that this patient is like this. So from the nape of the neck, okay, this headache will rise and it will go run forward over the head and to the eyes. Okay, it will go forward over the head and to the eyes. So this kind of a situation will be there. These kind of headaches will be there. Vertigo also ascends from the nape to the head, from the nape to the head, and it is aggravated by looking up, just like pulsatilla. Okay, so this is about this weakness of silica. Next, going on to the modalities of silica, which also form a very important part of it. Let's see. So while speaking of modalities, first point that he puts forward is that the remedy is chilly. So there will obviously be aggravation from cold. Okay, so this patient is chilly. Hearing puts it in this way, that there is want of vital warmth even when taking exercise. So you can understand the gravity of this. Okay, this patient is so chilly that even when he is taking exercise, even when he is doing exercise, he does not get warmed up. So normally, obviously, whenever we do when we practice, okay, when we do exercises, it is physiological that your body will heat up, right? It is very physiological that your body will heat up. But in silica, there is so much want of vital warmth, meaning that the body is not able to get warmed up even while taking exercise. So that is how much chilly silica is. He is sensitive to cold air, obviously. He takes cold easily. So he is not only sensitive to cold air, but whenever he gets exposed to cold air, he will take cold, meaning he will have sardi khasi, he will have this coryza, okay, cold and cough, especially when uncovering head or feet. So this is very important, that especially when they are uncovering head and feet, most of the times, if even if they get exposed to cold air, but they have, they're wearing a hoodie or something, or maybe they've covered their head and their feet also, they're wearing shoes, something, then they might not get affected. But especially when they are uncovering their head or their feet and getting exposed to cold air, they will get some or the other issue. Now, on the contrary, he is relieved by wrapping up the head. And also, but he'll also feel better when he wraps up the head. So both these things are there: aggravation when uncovering the head, and better when wrapping up the head, like Magmoor. Okay, so this is there. Now, the another point is that this remedy has a new moon aggravation. So when you talk about this, it is very interesting and beautiful to know that our doctors, our homeopathic masters, have such a great observation. New moon aggravation, meaning whenever there is new moon, whenever there's full moon, Purnima, these patients get aggravated. Isn't it very interesting? the symptoms of these patients get aggravated, get even more intense. We do not know what is the relation to new moon, that what is our body's relation to new moon, and how is that relation so strengthened that on a new moon these patients symptoms get aggravated, but it is seen like that. Okay, it is so Dr. Nash had several times found a silica child suffering from epileptiform spasms which were always worse at new moon, and a few doses of silica set them all right. So first of all, Dr. Nash observed this, that this child was always worse at the new moon. So see, look at the observation of this doctor. He observed it in so minute details. Okay, and because he did that, a few doses of silica set this patient all right. He was free from these epileptiform spasms. Next, we go on to the ailments from of this remedy, the causative factors, the factors which stimulate the vital force, or to or get derange the vital force. So, the exposing the head or back to any slight draft of air. So obviously we know that exposing the head or back to any slight draft of air will aggravate this patient because it is chilly. From vaccination, okay, so vaccination also gives rise to many complaints. There is a concept called as vaccinosis, if you know about it. So there's a the concept called as vaccinosis, which actually talks a lot about how vaccines cause a lot of trouble. So obviously vaccine helps with the disease that it is formed against, but it also gives rise, it can give rise to many other symptoms and diseases in patients. Okay, so that whole concept is vaccinosis. And silica, thuja, okay, these are kind of remedies which have these problems from vaccination. They'll come to you and they'll tell you that ever since I've taken that vaccine, I have had this problem. Okay, and when you give thuja or silica, obviously on the basis of symptoms and this ailments from, these patients will get better if the picture matches. So that is how from vaccination, this is a very important ailments from, and you should not forget about this. And also this modality you should not forget, new moon aggravation, because it is very interesting, right? Then the dust complaints of stone cutters with total lack of strength. So what happens is when stone cutters are like people who cut stones, they are involved in that kind of a work where dust is formed. Okay, they are working in such factories, or now here stone cutters doesn't literally mean only stone cutters, but any worker who works in a factory where there's a lot of dust production. Okay, small particles are produced, right? So in these kind of situations, what happens is they will go into your lungs through your nose and cause problems over there. So that can also be helped with silica. Okay, since silica is also sand, silica is also small particles. So see how doctrine of signature is to be found everywhere, and this patient also has these dust complaints. There's suppressed foot sweat. So ailments from suppressed foot sweat. So if a patient's foot actually patient in silica, the patient has a lot of foot sweat, and if that foot sweat is not allowed to get out, allowed to let flown off, and or you have your foot are in the shoes now, okay, and they are sweating, and you go into an AC room and you remove the shoes and put your feet against the AC, or maybe you go in rain, in a hilly area, and you put that feet against against the drafts of cold air, expose the feet to that. That will suppress your foot sweat, because it was actually coming out, right? Because the leg was very getting warmed up in the shoes, and the sweat was trying to come out. But since you in a quick span of time you just expose the feet to a lot of cold surroundings, that will suppress your foot sweat, and this will give rise to some kind of complaints in silica. So if your patient comes with some kinds of complaints and he also tells you that he had done this kind of a thing, he had actually this thing had happened, then silica can be the remedy. Now, Dr. Nash talks about this suppressed foot sweat even more, telling us that this foot sweat is actually very offensive in this patient. So, they have offensive kind of foot sweats. And offensive kind of foot sweats are also found in other remedies, like in Baryta carb, Sanicula, Sorinum graphitis, and these offensive foot sweats are easily suppressed by getting the feet cold. So as I told you, whenever the feet get cold because of any reason, then these foot sweats get suppressed, and that will give rise to symptoms. Offensive foot sweat seen. Okay. So let's see. So I have made this drawing also. So this is a chili patient, chili silica. Chili silica is afraid of getting vaccinations because he knows that a vaccination will aggravate his situation, will maybe give him a different situation altogether. At new moon also there is aggravation, and draft of cold air aggravates this patient because he is chilly. So this kind of aggravations are there in silica. He is a chilly patient, afraid of vaccinosis, obviously because it will give a problem, and new moon and draft of air. Okay. Next, he also talks about a few more points like that, like silica patient desires to be magnetized and is thereby relieved. So he has this desire to be magnetized, just like phosphorus has this desire to be magnetized, and that will also ameliorate him. Okay, he will feel better when he's magnetized. Silica is a chronic of pulsatilla. So we've already talked about pulsatilla, and at that point also Dr. Nash, when Dr. Nash writes about pulsatilla, at that point also he tells us that silica is a chronic of pulsatilla. Now, silica also has a great action on skin, and that is why Dr. Nash won't end the discussion on silica without talking about the skin. So he says that silica has unhealthy skin. Every little injury separates. Little injury also is there, pus filled form. Promotes expulsion of foreign bodies from the tissue. So this is very, very, very interesting. Promotes for expulsion of foreign bodies from the tissues. So if you have something gone inside of your body, like anything, it can be anything, maybe a needle, maybe whatever. Okay, silica will promote the expulsion of this kind of thing from your tissue. It will actually like remove it from your body. So you do not need even a surgeon's knife to do that. That can be situation, and there are cases like these. Okay, Dr. Kent actually talks about a case about this. You should go back and read Dr. Kent's Materia Medica, and you'll find a case like that. Fish bones, needles, bone splinters. So if fish bones have gone into the tissues, needles have gone into the tissues, bone splinters have gone into, so whatever, and you need to give silica. Silica will help remove that on its own. Okay, so these fish bones will come out on their own, needles will come out on their own when you give silica. So homeopathy is very, very beautiful. This point like will shock you in a good way, obviously. So that's about silica. We've talked about the constitution of this remedy, wherein we talked about the weak, lax muscles, pale face kind of a situation. We talked about the silica child, which has delayed milestones because there's mal-assimilation in this remedy, right? They do not have growth on right time. They have a big belly, right? They have a big belly. They have sunken eyes, pale face, right? Old looking face, pinched kind of. So this is there. Then we talked about the constipation and diarrhea. So constipation, in the constipation, the most important point was that there are shy stools in silica. And in diarrhea, we've seen that the common things like the dentition would aggravate or bring in the diarrhea, and the summer weather would bring in the diarrhea. The stools were changeable, right? While talking about the action separative pathologies, we saw that silica is used in the stage when the pus has already gotten out and the pus is already discharged, and you need to heal that area now. Talking about weakness, we saw that Dr. Nash tells us that this weakness is found in the mind, wherein grit is all gone, and also in the constitution of this remedy. And if you give silica, this patient's hope will revive and spirits will rise, and he will be back to strength and health. And modalities may we'll talked about first of all that this patient is chilly, okay, and they have they have lack of vital warmth, okay, they want vital warmth, and that is seen even when they're exercising, even when they're warming up. Exercising, when you do it at the start, it is also called as warming up, right? But this patient is not getting warmed up even after doing the warming up exercises. That is the situation of this patient, okay? He is sensitive to cold air, and especially uncover. See, he has covered his head. That has been drawn because this patient likes wrapping the head, okay, and feels better when he wraps up the head. Uncovering the head or removing the shoes, that is uncovering the feet, will give him problems. and wrapping the head will make him feel better. He also has this new moon aggravation, where we saw Dr. Nash has very beautifully observed that a child who came to him with epileptiform spasms was worse at new moon, and that is how he helped this patient with silica. We talked about many causes like vaccination. So from vaccination like thuja, this remedy also has some kind of aggravation or some kind of disease getting produced. And raft affair obviously aggravates this patient. Suppressed foot sweat was there. Offensive foot sweat is there in this patient, which if gets suppressed, that this patient will get some problems. There's dust complaints of stone cutters. So dust, say also there are problems, okay, in this patient. Uh, that was about the remedy. Then we talked about the few more points, like when we talked about few more points, like the desire to be magnetized, which is there in phosphorus also. Silica is a chronic of particle, and skin, very importantly skin. The bewildering point was that silica, which is just a remedy, when given orally, will promote expulsion of foreign bodies from the tissues like fish bone, needles, bone splinters, okay. So that's how silica is a very very interesting remedy, isn't it? Especially with points like this, points like want of vital warmth even when taking exercise. Now let's move on to talk about the second remedy, the last remedy that Dr. Nash talks about when he speaks about the group of anti-sodic remedies. Let's learn what he says about Calcarea Phos. So, when talking about Calcarea Phos, Dr. Nash very beautifully tells us that since there is an independent remedy formed of Calcarea carb remedy, and phosphorus is also an independent remedy, Calcarea Phos is a compound out of which we have made another remedy. Now, this remedy, Calcarea Phos, will have features of both Calcarea and phosphorus as individual remedies. So, Calcarea, normally we have seen that they have tardy bone development, right? Bone development is not very well. They have tardy bone development. And in phosphorus, the phosphorus element has this kind of a temperament with that they act on spare subjects rather than fat. So this kind of temperament is also there. The temperament that phosphorus has is present in Calcarea Phos as well. That is what he means to say, that the temperament which phosphorus has is present in Calcarea Phos as well. Plus, there is action on spare subjects rather than fat. Now, we've seen that Calcarea acts on fat subjects, on obesic. It's not a compulsory rule, okay? Even if a lean patient comes to you and presents to you with symptoms of Calcarea, then Calcarea will help. But it is seen that usually this remedy acts on Calcarea as an individual remedy acts on fat or obesic patients. Over here, Dr. Nash says that phosphorus, which actually acts on slender, lean kind of patients, carries on this symptom in Calcarea Phos as well. So Calcarea Phos also acts on spare subjects rather than fat. The temperament is like phosphorus, and there is tardy bony development like Calcarea in Calcarea Phos. Now this constitution which is formed over here, which will also seem like silica. Now we just now discussed about silica. They also have bone development which is tardy, and they are like pale, very weak kind of subjects and spare subjects. Okay, so this can be found out in silica as well. But now when you're thinking of silica, you should also think of Calcarea Phos, because since the constitution formed is similar, right, to silica and calcarea. But yeah, the remedy Calcarea Phos, and but the other symptoms will obviously help you differentiate. Now in silica, there is sweaty head, and in Calcarea Phos, there is no sweaty head. So that is how you'll differentiate. So obviously the constitution formed is similar, but you can differentiate with other points. So silica has sweaty head, Calcarea Phos does not. Now here, Calcarea carb has longing for eggs, as we have already discussed when we were talking about Calcarea. But Calcarea Phos has longing for hammerint, and Mac carb craves meat in scrofulous children. That is how all these three remedies have different kinds of cravings. Okay, then moving on to the diarrhea. In diarrhea, we see that the stools are green in color, they are spluttering. Okay, then the patient may be shrunken and emaciated and anemic, like having marasmus. So, this is how Calcarea Phos has a green spluttering kind of diarrhea, along with which the patient may be shrunken, emaciated, and anemic. So now what does spluttering mean? Spluttering means that, there's flatulence, okay, and along with that stool is there. So when it all comes out, there is a loud noise which is created when the stool passes, that is called as spluttering. So there's spluttering kind of stools in these patients because there's not only stool but also gases coming out along with stool in the diarrhea. So there are stools are green spluttering in the patient with Shankan. Okay. Then moving ahead to talk about a few more points that he speaks about is that rheumatic troubles are there in this remedy, which get aggravated in spring and fall and when the air is damp and cold. Okay, there are broken bones where bones refuse to knit, like in symphytum. Okay, we've seen in symphytum the bones do not, the symphytum actually helps in callus formation. So when you have a fracture and the bones are not like the bones are you are trying to get the bones back into position and back into health, you will see that symphytum helps because it will finally actually what it will do is form callus. Here, Calcarea Phos also helps to do the same. The headache of anemic schoolgirls like Natrum Moor, okay, and feels complaints more when thinking of them. See, so when he's thinking of his complaint, he will feel the complaint even more. The complaint will trouble him a little even more when he's thinking of the complaint. And when he has forgotten, he is busy doing something else, then that complaint might not be so intense. Okay, that is how. And this is also seen in oxalic acid and helonias. Okay, both these remedies also have this kind of symptoms. Okay, that was about Calcarea Phos. Dr. Nash very briefly, like he talks a little bit only about Calcarea Phos, and this is what he talks about when he mentions Calcarea Phos. So we've done Silica and Calcarea Phos right now. These were the remedies, the group of anti-sodic remedies of Dr. Nash. Right, we have talked about the other remedies which come under this group. We've already talked about sulfur, we talked about Calcarea carb, which is called as Calcarea austriarum by Dr. Nash. We talked about silica just now, and we talked about Calcarea Phos. So these are the 4 remedies that he mentions under this group. Okay, so we're done with it now. Let's meet once again when we'll talk about some other remedy.